For our integumentary system screencast, we chose the skin disorder melanoma, which is commonly known as a form of skin cancer.
Melanoma is the deadliest form of skin cancer, and it develops when pigment-producing cells known as melanocytes mutate from exposure to UV rays or the sun. People with red or light hair and pale skin are more at risk of melanoma as their skin is more sensitive to UV rays. An excessive amount of moles can also increase the risk.
The best way to prevent melanoma is by wearing sunscreen. However, if it develops and is discovered in its early stages, it is most often treatable by the removal of the affected area by surgery or through treatments such as chemotherapy or radiation therapy. Advanced melanoma is often untreatable, but immunotherapy can extend the lifespans of those living with the disorder.
The biggest sign of melanoma in relation to moles is the ABCDEs of moles. This can help doctors identify if moles have evolved into melanoma. When they examine affected moles, doctors will pay close attention to asymmetry, if the border is clearly defined, any variations in color, the diameter, and how the mole is evolving. In addition, other symptoms could include scaly skin, swelling, blurry vision, itchiness, or pain.
For those suffering with the early stages of melanoma, their quality of life will not be affected much by the actual disorder. However, if they endure chemo, immunotherapy, or radiation therapy, their immune system will be affected, causing them to lose their strength and ability to fight off other infections. The high stage of melanoma, also known as metastatic melanoma, can have more of an effect. As it spreads to other parts of the body like the brain, lungs, or kidneys, it can cause those organs to malfunction, resulting in possibly seizures or difficulty breathing.
We found an article on how the discovery of immunotherapy has affected those suffering with metastatic melanoma. James P. Allison from the United States and Tasuku Honjo from Japan won the Nobel Prize in Physiology and Medicine in 2018 for their work regarding immunotherapy. They both researched and experimented on how T-cell proteins that make up our immune system breaks can be released to enable a more forceful fight against the cancer. There were 2 drugs discovered that can release the immune system breaks. Unlike chemo, a person who undergoes immunotherapy has a much shorter recovery time after treatment. Although it does not completely cure it, due to this discovery, people diagnosed with advanced melanoma can now live for up to 5 years instead of 6 to 9 months.
And this is our works cited page.